As we approach the election this fall, it seems like the news media reports on little else. Unfortunately, too little of that news coverage addresses healthcare. That's wackadoo, because there's still so much to be done to improve the cost, quality, and access for patients within the U.S. healthcare system. So let's talk about the major health policy issues we in the United States face. This is Healthcare Triage News. Let's start with the cost of health insurance, especially in the exchanges. In the last few years, there seems to be fewer complaints about healthcare spending in general. That's partially because healthcare spending has grown more slowly than anticipated, especially within Medicare. But premium costs have been increasing more rapidly this year, especially in the Affordable Care Act, or ACA's, insurance exchanges. In 2017, most economists expect that increases in premiums in the exchanges will go up more than they have in the past few years. That's partly because the cost of medical care has gone up. But some of these increases are the result of stuff in the law, baked into the cake of the ACA. For instance, some of the programs that protect insurers from the consequences of underestimating expenses are ending this year. That makes premiums go up. Congress could act to increase subsidies so that monthly premiums hit fewer U.S. consumers hard. Yeah, right. But that would only merely shift the expense onto taxpayers as a whole. Congress could also work to bring healthier individuals into the exchange pool, which would lower premiums overall. That might be accomplished by strengthening the individual mandate. Yeah, that's not going to happen. Additionally, more competition in the exchanges could theoretically result in lower premiums. But that brings us to the next problem. There are fewer choices in the insurance exchanges. The last year's brought news of a number of large insurers leaving the exchanges in many states. That significantly reduced the number of choices available to those who purchase insurance there. It's estimated that 17% of people who might shop on the exchanges may have only one available option next year. No choice. Currently, Alaska, Alabama, North Carolina, Oklahoma, and Wyoming only have one insurance plan signed up to sell in the entire state. Insurers are exiting the marketplace for a variety of reasons, but they all coalesce around a general cause. They're having a hard time making lots of money there. That's partially because they found that patients require more and costlier care than predicted. It's also because saving money involves negotiating deals with physicians and hospitals at a local level, and that's harder for national companies to do than local ones. The lack of competition in many areas has led to renewed calls for the public option. Before the ACA's passage, public option proposals called for each exchange to set up a government-run nonprofit insurance program that could compete with private plans. By eliminating certain administrative costs, such a plan might be cheaper than private plans, which could help drive down the cost of premiums overall. It would also increase choice. However, it's important to remember that one of the major ways that insurance companies reduce spending is by setting up networks. That's going to be hard for public insurance plans to do, especially national ones. Creating the public option would be politically difficult and would require a major push by the president and Congress, which probably isn't going to happen. Fewer choices and types of coverage. Many of the national companies, which tend to offer broader coverage, are the ones leaving the exchanges. The companies that are left are those that tend to offer narrower networks, which constrain patient choices in where they get their care. From 2014 to 2016, the share of competitively priced silver plans that were PPOs, which usually offer some coverage for out-of-network providers, decreased from 50% to 27%. The percent that were HMOs, which typically offer no coverage for out-of-network providers, increased from 35% to 51%. With respect to national companies, the percent of silver plans offered that were PPOs dropped from 58% to 7%, with HMOs increasing from 12% to 50%. In 2016, in 7 states, no PPOs were offered at all in the exchanges. Less choice. Lack of access to affordable insurance for many. The biggest gap in coverage remains in states that have refused to participate in the Medicaid expansion. Because the ACA doesn't provide subsidies to families earning less than the federal poverty line, people in states that didn't expand Medicaid have few options available to purchase insurance. Recent observational studies have shown that in participating states, the expansion is associated with better and increased coverage, as well as improved quality of health. It's even associated with lower insurance costs for those who buy private insurance. The quickest way to fix this issue would be to expand Medicaid in more states. Barring that, Congress acting to grant subsidies to poor individuals in such states so they can shop for insurance in the exchanges would be more expensive, but would also reduce the uninsurance rate. And it's not going to happen. We shouldn't lose sight of what is improved. An additional 20 million U.S. residents who lacked health coverage are now insured. Spending has slowed to below what was predicted, but there's still much work to do. Calling for blanket repeal of the ACA and a return to the status quo is not an improvement, but failing to recognize shortcomings in reform and working to ameliorate them would be a failure as well.
Healthcare Triage is supported in part by viewers like you through patreon.com, a voluntary subscription service that allows you to support the show through your monthly donation. We'd like to thank our research associates Joe Sevitz and Karen Green, and our Surgeon Admiral, Sam. Thanks, Joe and Karen. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.